The city created the Housing TO Action Plan because if you go back to the past, we had a series of silos, different kinds of initiatives, and there was never really kind of an overarching look at the housing needs the city had so that you could be sure that you could build a city and have a city in which everybody's needs could be met for housing.
Toronto Alliance to End Homelessness, our vision is that homelessness become rare, brief, and non-recurring in the City of Toronto. One of the successes that we've had in working with the city is that is now also the vision in the Housing Charter and in the Housing TO Action Plan.
The Neighborhood Land Trust is a community land trust that removes land from the speculative real estate market and assures that that land is used to meet community needs, and in particular, affordable and supportive housing. And so when we remove the land from the market, we make a commitment to the community that we're going to preserve those properties as permanently affordable indefinitely. The Community Land Trust is an amazing partner to the city because we both share the value of wanting to create permanent, long-term housing solutions.
Through this partnership, the United Church is looking to maximize social impact. Our real estate development model is about looking at community assets in an inclusive way and unlocking value for social purpose, including affordable housing. By developing property and maintaining it in the common good, we're able to keep those vital community assets in the communities in which they were built.
I'm very pleased that such a robust partnership has developed between University of Health Network and the City of Toronto. Many of our patients, particularly patients who would very frequently use our emergency rooms across sites, are people who are experiencing homelessness. So some of our most frequent users are those who are in emergency rooms, not necessarily because of medical emergency, but there is nowhere else for them to go. So UHN created its social medicine initiative, and then closely working with the city, really began looking at where and how we could address this in a systemic and meaningful way.
What I'm most excited about is the relationships of health, the City of Toronto, the not-for-profit sector, the broader commitment in the Canadian conscience of how important housing is as a human right, as a structural determinant of health. The pandemic has made it clear how critical it is to have shelter and housing as a foundation for well-being and belonging in this country that we love.
We are huge fans of the Mayor's Housing TO initiative. We applaud what the Mayor and City Council is doing on housing now, so critically important, and the movement, the accelerated movement on modular housing. Just modular housing alone that was unleashed in 8 months during a pandemic, and I think it's generated somewhere in the neighborhood of 150 to 250 more units very quickly. So we're fully on board with all these initiatives and would love to help scale them up beyond that.